could turn back to the issue of cybersecurity where we left off, there's obviously a need for experts in the field of cybersecurity, and certainly our departments, our agencies have seemed to have quite a few cybersecurity related incidents over the past several years. And I think that utilizing our assets, including your cyber team, as well as our resources that we already have here at our disposal, rather than contracting out to third-party entities, would be the most efficient and effective approach. Does your department have any thoughts on this?
Well, I think that we have some expertise, Senator, that can be utilized to help. It's just having the means to be able to mobilize them to action. Some of the instances that we're involved in, we get the actually request for help, and so we have to be invited. But I think if we are, most people are willing to have federal assets come into a state situation and actually help. So the expertise we have in the 112th Cyber Operations Squadron, the Air National Guard, I think could be helpful, Senator, and also the DCOE in the Army National Guard could be helpful. We just need to be able to bring them on orders to be able to have them assist in this area, and that's where funding would become a challenge.
Understood. Thank you. And if I could turn to an issue that our veterans' homes, our hospitals, probably every healthcare-related entity is faced with, and that continues to be a nationwide nursing shortage. Can you tell us what the effect has had on the operations of our veteran homes and what the department is doing to enhance the recruitment of nurses?
Absolutely, Senator, and you're absolutely right. You know, we're competing with everyone else out there for the same pool of nurses, the same pool of those folks to care for our soldiers, whether they be in airmen and service members, whether they be in a local hospital, whether they be in one of our homes. So we've continued to drive recruitment and retention efforts towards that. We've had open Wednesdays, I think they're walk-in Wednesdays and so forth, where we allow people to come into those homes. We've tried to partner with various homes where we've invited students from colleges into the homes to say, hey, here's the working environment that we have. We've truncated salaries and provided truncated salaries to employees to say, hey, we could bring you in, start you at a higher rate because of your experience, because of your what you bring as a specialty. So those are some of the efforts we tried. Maureen, did I miss any?
No, sir. But to answer your other question, ma'am, you know, operationally, we've not put veterans at risk. So where it impacts veterans is we have a waiting list of about 350 veterans who can't come into our home, but we won't sacrifice the quality of care by pushing that envelope. So we have empty beds, unfortunately, but the quality are up. Our revenue is up because we're helping folks with their disability rating. The homes are doing very, very well, minus the shortage, but we have a higher staffing ratio than probably other homes in this Commonwealth.
That's good to know. Has there been any thought at taking the care into the veteran's home as opposed to putting the veteran in your home? Would that provide any type of relief?
If the veteran can stay at their home longer, ma'am?
Right.
Yeah, you know, you have to remember our veterans are majority male. Some of them have severe disabilities and need skilled nursing. It's not easy always to stay in a home that has 2 floors if you can't have an elevator to get up and down, the equipment, the oxygen. You know, there's just some of the veterans really need nursing care, skilled nursing, full-time, 24/7, and I think that's the difference. We would encourage veterans who are just aging to be able to stay in their own homes for sure, with aid and assistance and programs that the VA has. And you know, General Schindler partnered with the Elizabeth Dole Foundation to support caregivers. So those are programs that we're doing to help. But there's a different need when you're talking about veterans that really need to be in a skilled environment, unfortunately.
Thank you. Appreciate your insight. Thank you, Mr. Chairman.